Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're going to be talking about the medication betamethasone. So this video is a continuation of my series on OB meds. Now betamethasone is a glucocorticoid. It has many different uses and can be given in many different forms, but for the purposes of this short video, I'm going to be discussing what we would use it for in obstetrics or labor and delivery. So let's get into it. So like I said, it's a glucocorticoid, and what it's used for is to enhance fetal lung maturity and increase surfactant production in the preterm infant. So if you remember, at term, babies, they come out, they take those first breaths, they have an adequate amount of surfactant in their body to allow them to do that. If you remember, surfactant is what helps keep our alveoli from collapsing. Preterm infants oftentimes either don't have a lot, they don't have enough, or they don't have any at all because they're so premature that they haven't started making any. So betamethasone is a big helper when it comes to this patient population. We have seen through studies a significant decrease in the morbidity and mortality of these preterm babies with the use of this medication. So it enhances fetal lung maturity, helps with surfactant, that's the big thing. So it can also, because it does these things, decrease babies' risk of having respiratory distress syndrome. It also helps decreasing the risk of neck, so necrotizing enterocolitis, and intracranial hemorrhage. So that's wonderful. These are kind of just extra things it does in addition to the respiratory distress. These are things that have been seen in studies. So how do we give it? We actually give it to mom while she's still pregnant. So the pregnant woman comes in, she's in preterm labor. We try our best to stop that labor if we can, and we give them betamethasone if we don't think they're going to be able to stop the preterm labor. That way, when the baby is born, it has a better chance at breathing. So ideally, we would give 2 doses, 12 milligrams, 24 hours apart. Now, typically, does this happen like that? No, not usually. Usually, most people just get 1 dose because they deliver too quickly. They deliver before that 24-hour mark where they could get the 2nd dose. But that's okay because even 1 dose decreases the death rate by 40%. So that's huge. So if mom comes in, she's in preterm labor, we're not going to be able to hold her off a whole 24 hours. At least we get 1 dose in. That's great. That's still going to be a big help to her. So it's an IM injection, that's how we give it, and we give it into the gluteal muscle. And so we give it to mom, but it actually goes to baby. So it's to benefit baby, but we give it to the mom. And some important things you need to look out for. Checking for pulmonary edema for mom, so that's things like shortness of breath, respiratory symptoms, hyperglycemia, and then always assessing baby's heart rate. These are not common issues. Common issues include things like flushing, sweating, and a higher blood pressure because it's a steroid and we know steroids can cause these things temporarily in mom. So that was a very short little video because I wanted to make it very specific. These are the key points, the big stuff you need to know about betamethasone, in my opinion, one of the miracle drugs in OB. Thank you for watching. If you have any questions or comments, please let me know, and if not, I'll see you on the next one.